Our last presenter of the day before we go to the patient's share testimony is Sabina Artrip. She started as an LPN in 2011, then continued as a registered nurse in 2016. Her career started out in nursing home community with a transition to Riverside in 2016 as a registered nurse. She came to OSU in 2017 to the general internal medicine in the triage department, the clinical area, and then as nurse case manager. She took on the role of PCRM, which is Patient Care Resource Manager. That's her title right now. And in 2020 with our clinic, and she is here today to talk to you about the services around provided by her department. And she'll give a summary of what social work does as
Oh, hello, everyone. I'll try to make this fast. I know we're all tired. Like Fum said, I'm a nurse case manager. We work hand in hand with the social work department, so I'll also be talking about the resources that they offer. So, what is a PCRM? Actually, I have a question. How do you go next? Just click it? Okay. Oh, that's easy. Thanks. What is a PCRM, also known as a nurse case manager? And what exactly does that have to do with you, right? PCRM is as shown, a patient, sorry. PCRM stands for Patient Care Resource Manager. And as this slide shows, case management is a dynamic process that involves making an assessment, creating a plan, implementation, coordination, monitoring, and evaluation of this plan. We do this to improve the outcome and experiences and the values that a patient goes through. Case management is a professional collaborative in various settings where medical care, health, mental health, social support are delivered. We facilitate services with patients and their support systems in pursuit of health equity, identifying needs, ensuring appropriate access to resources, services, addressing social determinants of health, and facilitating safe and care transitions. So let's talk about the process for a minute. During our assessment, in order for any situation to work out, we ask a lot of questions. And it is important for patients to be very honest and open with the healthcare providers when answering these questions. Just like an investigator, we go through gathering all of the information, which is vital in order for us to know whether the plan of care is going to work out or not. If not, then we start the whole process again. During the plan of care, after questions have been answered, the PCRM then formulates a plan and sets goals with the patient and their support systems. The doctors involved, the pharmacists, the social workers, dietitians, anyone in the entire care team, we speak to them all as a group. We then move on to implementation. Now, with implementation parts of the plan, this usually involves making sure that orders such as medication orders, wound care supply needs that a patient might need, hydration at local agencies or medical equipment, and so on have been placed in a patient's care plan properly by the appropriate discipline to avoid lapse or gaps in their care. With care coordination, this intertwines with the implementation of the plan of care. Coordination can look like PCRM contacting other disciplines, making sure that everything they need on their end, such as the hospital documentation, has been received. We also make phone calls out to the patients to check on them, depending on the severity of their situation. Could be daily, especially with making sure that they have medication management is going on as planned and as expected. Symptoms are under control. If we encounter any difficulties in the patient receiving their medication, for example, like we have to contact all the appropriate areas to make sure that that is up and running. Issues such as like approval of insurance companies, coverages. We have to go through all of that. There are PCRMs in the inpatient world as well as the outpatient world. In the inpatient world, they have to do a daily review of what's going on with the patient and have to prove it to the insurance companies to allow the coverage to go through for the patient to still have their proper care given. Um, Care coordination can take many forms, as I said. At times, the patient does not have a support system, for example, which can make their cancer journey very difficult. There are times when I have actually had conference calls with patient families in order to discuss with the who can help, the what's needed, the whens and the whys. And this, of course, is after the patient has given permission for us to be able to discuss this with the designated persons. Nurse case managers, or PCRMs, also assist patients in completing the appropriate documentations, such as like the healthcare power of attorneys or living wills, and provide the education that comes along with it. Through the assessment, we can find out what services that the patient can also benefit from, and we make referrals, such as the James Care Clinic, um, either a skilled nursing facility, palliative care, or at times hospice when needed. We then monitor the charts for the patients that we are managing to make sure that we have implemented everything to stay on track. We monitor the patient's symptoms, as I said, monitoring any changes in their condition, the insurance coverages, anything that can potentially throw off the plan. Then we come back and reevaluate everything. Then we follow up as needed, and this is it goes around and around, it's an ongoing process, sort of like wash, rinse, repeat. Then teaching. Teaching is, I think, uh, the best component of being a PCRM, because what I've come to find is most people will be compliant and are compliant if they understand their treatment plan, they understand their disease process and the reasons why they need to do what you advise. Um, so these are some of the examples of the things that we find our patients need mostly, either oxygen needs, walker or rollator for safety, as well as a wheelchair, hospital beds. We can also order, and most insurance cover these. I know that with the hospital bed, people have questions. Am I going to pay for this? How does this exactly work? With the walker and wheelchair, there is an out of pocket depending on your insurance coverage. But with the hospital beds, what we've come to find out is it's a rental. So once you're finished, then you just take it back and insurance covers for that. Does anybody work for the insurance company? I was about to say we have words. So with the rehab facility, for example, sometimes patients from the inpatient world have to be discharged to a rehab facility for a short amount of time before they can safely be released back home to their own environment. There's wound supplies that also comes into play, where I've come to find out that some patients were ordering their own wound care supplies from Amazon. Amazon is great, but if your insurance will cover for it, then, contact your doctor and just find out. They might be able to do that for you. Home health services, though, I wanted to mention, because sometimes we feel that we have the information, home health services. So therefore, the services are going to come to the home, but we think that it's going to be on a daily basis. No, insurance companies will only cover for like once a week visits, or maybe twice if we're lucky, depending on how bad or severe the situation is. So, and it also requires a skilled nurse to be able to come out there. Skilled nursing needs, such as somebody starts in an IV or something that a nurse aide cannot do, for example. Also services like physical therapy and occupational therapy, they will cover. So also wanted to mention that they usually, when home health services comes into play, they usually would like a person that they could teach, a teachable person, so that on the days that they don't show up, that person is going to deliver the care. Now, I know that we all probably know that might not always be possible. So when patients are coming into these kind of environments, and I know people like to keep things private, but it's very, very vital to have a support person of some sort. And it's great if we can also help others in our communities if we hear about it. Just the support part is very, very crucial. I'll talk about the care clinic. It's one of the referrals that we can make. The care clinic is located at the James fifth floor. Also at Olentangy River Road, there's one location there, and across Martha Morehouse, Kenny Road, there's a care clinic. What is care clinic? And what did I do with my piece of paper? I like care clinic, actually love it, because, one moment. So care clinic to me should be what healthcare should have been from the beginning, because it comprises of about 7 providers that see you on the same day. Now, granted, it's going to be a longer visit than normal, which means about 2 or 3 hours of a visit. And I usually tell patients, if you're scheduled for this clinic, pack a lunch, bring something you like to do, a book, knitting, because instead of having different specialties scheduled on this day and the following day, which everybody has busy schedules, they all see you on the same day in that same clinic. And they keep coming in and going out, and you'll be busy because you see every specialty after the next person. What I followed that clinic for a minute. What I loved about it is they all sit around and they discuss each patient. They have them listed on the board. The pharmacist is in the same room. So everybody hears the same, everybody's on the same page. It's not like some cook comes in and sprinkles some salt and leaves, and the next person comes and, was there salt? We don't know. Sprinkle some more salt. So everybody's on the same page, knowing what the plan of care is. And I love that. Within that clinic, you're seen for an audiologist sees you for your hearing. A nurse comes in and does a memory cognition visit with you. There's the pharmacist that does a full medication review, because it's very important to know what we're mixing in our bodies. You have the dietitian does a thorough nutrition evaluation. A physical therapist, excuse me, comes in and then they do their job. The social worker, partial to them, they also come in and evaluate the caregiver, making sure that financially you're okay. Any home safety concerns are dealt with. If there's a quality of life type issues, they also deal with that, and they make references, referrals, sorry, to the specialties that are needed as needed. Now let's go into social work services.
Sabina,
Sorry.
what's the age limit to refer home care?
Thank you. I forgot to say this. Age limit is for our cancer patients is 60 years and above. So for either sides.
If you need that, you have to tell your providers, we put in a referral.
Yeah, absolutely. But also if your provider has a nurse case manager or PCRM, they can, okay, the I guess the criteria that will stand out to us to give you a referral for the care clinic is somebody that's been having recent falls, or memory issues all of a sudden. Those kind of major changes, to be able to see if they can assess you from head to toe and make the necessary needs and adjustments. All right, so advanced directives, move on here. I talked about all these, sorry. Home support, community services that are used, which was the skilled nursing facilities or physical therapy sessions out and about. Symptom management is a big thing we do almost every day. People who have low income or insurance or self-pay, we have financial services and financial counselor. For us, it's for Seymour. She's awesome. They also have a MAP program, which helps with making payments with medication assistance program. Basically, patient advocate. that's me. So then I talked about the care clinic. That was a slide. The providers. So social work. First one is the advanced directives that they offer. Advanced directives are legal documents filled out by the patients, which provides medical care instructions when patients cannot speak for themselves. They include, but are not limited to, the healthcare power of attorney and the living will. The packets that we provide for our patients also have the information, educative information, and then frequently asked questions throughout the booklet. Let's talk about hospice. I know hospice has a bad name. Hospice is actually a great service that is provided when a doctor determines that the prognosis of a patient is 6 months or less. Understandably, not all cultures like talking about death and dying. Hospice provides symptom management, ensuring patients are comfortable during end-of-life stages, and can provide around-the-clock nurses, depending on the situation there. And then they also have crisis intervention, which includes the social workers performing a suicide assessment and placing referrals and creating a safety plan with the patient. Counseling and psychiatric referrals can also be placed. The James Care for Life counseling services, yes, I'm partial. They are better than regular counselors. And I say that because they're not just regular counselors, they are also cancer informed. So they can understand what you mean, what you're going through, and other ways in which they can assist with that. The social workers also take care of safety concerns. And this refers to cases like domestic violence or skilled nursing facility or rehab centers sometimes have issues, and probably have heard of the word ombudsman. So they help navigate the right ways to deal with these problems. I know that they do not remove the patients from the facilities that they are at because they don't have the authority to do so. So they go through the right channels, and if transfers need to be made, then that needs to be done from within the facility, because each facility should have their own social worker there. Mental health needs. This goes hand in hand with depression, but a little less intense. With the community resources, sorry. Transportation assistance is the most commonly requested assistance that they need. So they work with patients' insurance and try any kind of other community type resources that they can find to assist patients with this. Other resources have other resources that we have and they offer, bless you, is the cancer survivorship clinics. Food assistance is also something they help with. Central Ohio Agency, I knew it. Central Ohio Area Agency on Aging is also one of the resources that they help patients with. The Franklin County Senior Options, and so on. All in all, it seems as, bless you, patients over 60, they're found, like there are more services available with patients over 60. And for some reason, there are more resources available to patients who carry Medicaid rather than Medicare. But yeah, this is the end of my presentation. Thank you for your time.
We have flyers out there that show all the different services available at the James, including all the psychosocial support as well. So I hope you guys all picked up on that.